Now, what about decelerations that mirror the uterine contraction? Well, those decelerations are called early decelerations, and this heart rate deceleration is bowl-shaped and it mirrors that contraction. It is directly above it. And these are okay. This happens because of head compression, and it's a healthy autonomic response to the contraction as it compresses and squeezes on that fetal head because it indicates progression to the second stage of labor, which means that that head is just low in that pelvis. So what will we do? Well, since these are okay, we'll continue to monitor, but we'll also assess to see the cervical dilation and prepare for delivery if it's imminent. Now, our next one is going to be fetal heart rate accelerations. And accelerations are opposite of our decelerations. This is where the heart rate is going to temporarily increase at least 15 beats per minute. These happen all the time throughout the pregnancy, and they don't have to align with uterine contractions. These are okay or indicate that we have healthy fetal well-being. Think about when you go up the stairs and your heart rate increases, and we want that, right? We wouldn't want our heart to be a flat line when we're moving around. We want fluctuations or accelerations in our own heart rate to get blood pumping throughout that body. And that's what's happening here. The baby's moving around because it's happy and it's healthy, so that fetal heart rate increases or accelerates. And this is a healthy response. What about late fetal heart rate decelerations? Well, these decelerations start after the contraction, unlike early decelerations that mirror the contraction. These are not good, and they indicate placental insufficiency or fetal hypoxia. Now, this can be from anything that interrupts blood flow, whether it's a drop in maternal blood pressure or a problem with that placenta, like a placental abruption, or not enough rest period for reperfusion, like with uterine tachysystole. So for this, we're going to treat that cause. So stopping oxytocin, giving IV fluids, and of course, we'll provide our intrauterine resuscitation or stop-in. All right, time for your next NCLEX quick check. So pause and answer. Which deceleration is abrupt and occurs independent of contractions? And what does it indicate? Well, remember, this is where we'll use our veal chop. So this is variable decelerations, and this means we have cord compression. Which deceleration mirrors the uterine contraction, and what does it mean? Well, if it's mirroring, then we have early decelerations, and it means head compression. That head is getting squeezed because we're close to delivery. Which deceleration starts after the contraction, and what does it indicate? These are late decelerations from placental insufficiency.